Assalamu alaikum and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show. And I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I pray we all had a nice and positive week so far and looking forward for a nice and chillaxing weekend. The show is broadcasting live today on 25th of September 2025. And from the studios of Inspire FM for our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpeth and Bedford. Our airways are reaching to all our listeners and viewers who are listening us through Inspire FM radio app or website, or viewing us through Inspire FM YouTube and Facebook channels. Assalamu alaikum and good evening today. Today's show is something which we all suffer in our life. One way or another. Yes, it's pain. Pain is something which we normally suffer in our life one way or another, and it has its own repercussions, and we always want to get rid of pain in one way or shape or form. And that's why we thought, okay, let's talk about something specific, and that's why the today's show has been designed in that way. So without further ado, the topic for today's show is nerve pain. Yes, you have heard me correctly. We are talking about nerve pain today. And definitely we'd like to know what is nerve pain and how we can help ourselves to reduce the problem of nerve pain in our body. And helping me to resolve this issue is we have a guest today, alhamdulillah. So it's good that you should know I'm not the one who will be talking about today's show all by myself. We have a lovely guest with us in the studio today who will be talking about this topic, and he is a very dear and near friend and my GP as well. He is not new to this show. He is a regular doctor on call. Whenever we want him, we always have him, alhamdulillah. Although this time it's a really long gap since I have him on my show. He is none other than Dr Talib AbuBakar. Assalamu alaikum, Dr. Saab.
How are you?
Alhamdulillah, Dr. Saab. How are you?
I'm good. Thank you very much.
So, Dr. Saab, people who do not know you, can you give a quick introduction about yourself?
I'm a local GP in Luton. I've been here nearly 30 years in Bury Park, Bell House Medical Centre.
Mm-hmm.
I'm the senior partner there. And I learn from my patients and hopefully pass on that information back to others.
Alhamdulillah. Yes, indeed. And to be honest, there are so many patients of yours you have helped, including me. Alhamdulillah, I'm one of the, I feel myself blessed to be part of your patient congregation in that sense. So, Dr. Saab, in terms of, before we jump into topic, you said how long you are working in this field, in GP, in the line of GP?
Yeah, October 1995 is when I arrived in Luton, all the way from Newcastle.
Wow.
So, yes, time's caught up with me. Nearly 30 years.
Wow, 30 years.
Next week. Yes, 30 years next week.
Mashallah. So we should celebrate the 30 years. 30 years of Luton practicing.
I'm still smiling.
Alhamdulillah.
It's a great job.
Alhamdulillah. And yes, it's always pleasure to have you on my other side, because I'm less nervous when I'm in front of you.
Great.
Alhamdulillah. So, Dr. Saab, as I said, that the topic of today is nerve pains. So, for our listeners, can you describe exactly what is a nerve pain and how is it different from a normal muscular or joint pains?
It's a little bit of a misnomer because pain is passed on to your brain by nerves. Mm-hmm. So all pain is nerve pain, technically. Uh-huh. But when we talk about nerve pain itself, we're talking about the larger or smaller nerves being damaged or pressed, giving you certain types of symptoms. And the symptoms that we normally talk about are burning sensation, tingling sensation, and often like electric shock like pain,
Mm-hmm.
rather than the gnawing pain of like toothache, for example, or bellyache, where it's griping, comes and goes in waves. So that's pain in itself. It's still passed on by nerves.
Mm-hmm.
But I think when typically we're talking about nerve pain, we're talking probably the nerves that supply the musculoskeletal system, your arms, the legs, your back,
Mm-hmm.
and things like that. So that is normally caused by pressure or inflammation of those nerves or damage to those nerves. And they give you those typical symptoms that I mentioned: burning, tingling, loss of sensation,
Mm-hmm.
and then if it gets much worse, loss of function of that muscle.
Wow. Okay. So, in when we talk about nerve pain, is this a big issue in Luton as well?
Well, worldwide it's big. In Luton, particularly, there's certain conditions you need to think about when you're talking about nerve pain, because what people don't often add up is what are the potential causes.
Mm-hmm.
And one of the big problems in Luton is we have a very high Asian population, and diabetes is very high, 6 times higher than most the non Asian population. Caucasian
Wow.
population is 6 times higher,
Uh-huh.
and we've shown that in Luton being a higher Asian population.
Mm-hmm.
The problem with diabetes, everyone knows that as high sugar. The high sugar is poisonous to your tiny blood vessels that supply the nerves,
Mm-hmm.
and they damage the nerve, which then causes nerve damage.
Mm-hmm.
And on its way to damaging the nerve to stop it working altogether, you get pain. So that's why diabetes is an unusual cause. Those who are suffering from peripheral neuropathy or any nerve damage from diabetes will know about it.
Mm-hmm.
Those who don't suffer from it don't think diabetes causes nerve pain. They know about heart disease and kidney disease and so forth, but nerve pain is quite considerable. Then the next one, which is also semi-attached, is weight.
Mm-hmm.
If you can imagine your spinal column that supplies the nerve to the rest of your body from your brain. So you got the brain, and then you got the spinal column, and the back protects that.
Mm-hmm.
But if you're overweight, you're putting extra pressure on that structure,
Mm-hmm.
which then bends and is held in different shapes, which then causes pressure on the nerves.
Mm-hmm.
And if there's pressure on the nerves, you get pain.
Right. Right.
Okay. So weight, osteoarthritis, wear and tear, which is then also linked to weight,
Mm-hmm.
and aging. When you get wear and tear, the joints that hold the spinal cord and keep the nerves well protected then start to move. The ligaments get a bit weak. The disc between the vertebrae, which is the backbone, starts to become moving, and
Mm-hmm.
what they call, it's almost like a balloon. It gets squashed, and the disc pops out and
Mm-hmm.
pops in, pops out. Every time it pops out, it hits the nerve, which gives you pain.
Ouch.
So things like sciatica, for example, it's
Mm-hmm.
quite common with lower back pain. Um, it's a sharp shooting pain down the legs.
Mm-hmm.
And then other types of pain, you can get certain types of infection.
Mm-hmm.
So virus infection. So, COVID just seems around the corner. It was nearly 5 years ago, the worst of it. But nerve pain from certain infections, virus infections particularly, so it's like chickenpox, which can later present as shingles, can cause nerve pain.
Really?
So that
Wow.
damages the nerve,
Mm-hmm.
because the chickenpox virus stays dormant in your spinal column for everyone who's had chickenpox, for all of us at risk of it. And then something triggers it off, like a bad infection or stressful time or something triggers the chickenpox virus, the varicella zoster virus, to trigger, and it comes down the nerve and forms these blisters that everyone may know of. But that's damaging the nerve as well, and some people are left with quite severe nerve pain, what
Wow.
we call neuralgic pain, either burning or sharp shooting pain. And then there's other viruses, or mechanical, where it can press where smaller nerves, like in your face, where the bone gets, where the nerve goes through the bone, it inflames
Mm-hmm.
the nerve for whatever reason, and often it's a viral infection, and you get things like trigeminal neuralgia and things like that, which is again a nerve type pain,
Mm-hmm.
and that's a very sharp shooting pain.
Yeah. I can absolutely understand that pain. I've just been through that one.
Yeah, and it's quite severe. So um, so we see a lot of it, but the good news is often it's avoidable.
Hmm.
Firstly, preventable. Secondly, we can do things about it. There are medication and more, before we go on to injections and surgery, there's medication that we could try.
Hmm.
But equally, there's a lot you as the patient, me as the patient,
Hmm.
can do to A, prevent it, stop it happening,
Hmm.
and B, if it does happen, how do you reverse it? Because if you leave it too long, it can damage and stay damaged, and you're not going to get much back.
Oh, okay.
Yeah, if that, because nerves are very sensitive to damage.
Hmm.
So if you damage a nerve, like for example, if you cut a nerve,
Hmm.
a car accident, and you sever your spinal cord, break your back and sever the spinal cord, it won't grow back.
Hmm.
May do in the future, but at the moment, it won't grow back.
Ouch.
Yeah. So all your nerves are like that. Fortunately, if you bruise it, there's a
Hmm.
chance of it coming back. But if you actually damage it permanently, so that's why we're very careful with people with diabetes, for example. Why we check their feet, why we check the sensation of their feet, because that's the first place it goes.
Hmm.
And often the nerves goes before other things. Sometimes it's the back of the eyes. Sometimes your kidney starts to leak a little bit of protein, and sometimes your feet start to go numb. And that's
Hmm.
why we check those things. That's why we insist people go and get their eyes checked at the back of the eyes, because that could be the early signs of further damage from the diabetes.
Hmm.
That's why we insist people get their urine checked every year. And a lot of people don't.
Yeah,
Yeah,
exactly.
they
Because
know to do their blood pressure, they know to do their blood tests, but they don't bring their urine samples because it's the early sign that if they're leaking a protein called microalbumin, that's an early sign that there might be damage happening, and also the nerve endings start to get damaged.
hmm.
Um, to be honest, that's about the third thing that goes wrong. The eyes and the urine are first. So once your nerves start to go, you're not going to get them back.
Hmm.
So imagine having pins and needles all the time and you can't, there's nothing we can give you that will completely reverse it. There are some medication that takes some of that symptom off.
But nerves, when so before I jump into that, let me introduce our listeners as well. So, listeners, if you have any questions or queries regarding our topic today, which is nerve pain, please get in touch with us by calling us on 01582 481 I repeat, 01582 or you can send your text messages or WhatsApp on 0779 481 I repeat, 0779 or you can send your messages through our Facebook or YouTube channels as well. So, Doc, in terms of, I know you mentioned about different and most common causes of nerve pain in adults, and you have also mentioned about diabetes and obesity. Now, in terms of the, uh, does things like uh, uh, the health risk of South Asian families, how much health risk of South Asian families contribute towards the nerve pain in general? Because as you know, unfortunately, we have a very bad habit of eating unhealthy foods, not going for walks or healthy activities in any shape or form. So when we talk about people at risk, like some, for example, some of the South Asian families, adults, is there more problem or prone to having nerve pains?
Um, it's anyone can get it.
Hmm.
Okay. So the analogy I always give you is I can drive on in the motorway 70 miles per hour, follow all the rules, and might have an accident.
Hmm.
But my chance of having an accident is much greater if I go faster,
Hmm.
if I abuse the rules. And the rules are quite simple. Avoid diabetes, which is by eating healthy.
Hmm.
Now, there are unfortunate people who get diabetes and they've got the best diet, best weight, no family history, and type 1 diabetes. That's just unfortunate in the same way if I follow all the rules on the road.
Hmm.
But the key is to then control your diet and exercise and things.
Hmm.
Type 2 is preventable, type 2 diabetes, by eating healthy. Once your sugar starts to go out of control, it starts to damage the nerves, which then gives you pain. but also it gives you general aches and pains because sugar is poisonous to the body. That's the simplest way of talking. I
Mm-hmm.
can't, no point going complicated on exactly what the pathophysiology of it is. Um, I'd have to look that up. But in terms of just simple terms, sugar is poisonous for you,
Mm-hmm.
and poison causes pain.
Mm-hmm.
Yeah. So common things we see is shoulder pains, back pain, muscle aches, and then nerve pain. So in Asian, so if you look at an Asian family from 50, 60 years ago, from the village in Pakistan or India or Bangladesh,
Mm-hmm.
farmer who goes out farming, the mother's doing lots of work as well, physical work. They didn't have diabetes. The risk was something like 1 or 2%. You take that same family and stick them into a town with modern facilities, lack of physical activity, food everywhere, and high calorie foods, so
Mm-hmm.
processed foods particularly. It doesn't matter whether you're in England or uh, Delhi or Dhaka or wherever, any of the capitals, you go there, that family's chance of getting diabetes is 10%. And in Luton, we're going up to 12%, 14%.
Wow.
Yeah, and that's being shown across the world in affluent areas.
Mm-hmm.
So it's a disease of affluence, diabetes. And we can see it,
Mm-hmm.
the number of patients I see during the month of Ramadan who actually put weight on the month of fasting. Yeah, how's that possible? It's
Indeed.
because we're eating the wrong things
At the wrong time,
at the wrong times.
in the wrong quantity.
But they tell you what we should be eating. It's written what we should be eating. But for some reason, we seem to think, oh, we've only got 8 hours to eat. Let's eat as much as we can for 8 hours, and high energy stuff. Oh, I better eat a bit more just in case I don't wake up in the morning. So they eat even more. So, you know, obesity is definitely high amongst us as well. So that's linked with diabetes. You can see the numbers of diabetes going up at the same time as obesity going up. And that, if you're carrying more than you should be, it affects
It affects
your
the body.
structure of your body. The skeleton is like the building, the scaffolding of your body, but that's going to wear more. And when that wears, that's going to cause pain. It's not going to function as well as it should do. So you've got instability. And when you've got instability, the nerve gets pinched here and there, and then you get nerve pain. So the three major causes of nerve pain, I'm not saying that's the only cause, because, you've got other things like B12 deficiency, infection, like I mentioned. Certain types of cancers can cause nerve pain. But the three main ones, obesity, diabetes, and osteoarthritis, are things that we can protect ourselves against and prevent, or work on and reduce. You'd be surprised when people lose if they're overweight and they lose 5% of their weight, how much difference they feel.
I to be honest, I can relate to that one as well, because recently I've alhamdulillah trying to, thanks to your guidance, trying my level best to reduce that weight. Now, in terms of the signs and symptoms of so what symptoms should people look out at home for these things?
So normally it's a bit of tingling,
Mm-hmm.
burning, particularly in the feet or hands. There are other conditions that cause hands where it's mechanical, like carpal tunnel, for example. Carpal tunnel is an interesting one. It's a nerve that runs in the middle of your palm, and it goes through a tunnel of bone, and there's what we call a fibrous tissue sitting over it. When it goes through there, if you become overweight or if you get arthritis or anything like that, that nerve gets squeezed. That nerve supplies your thumb, index finger, middle finger, and half of the ring finger. It doesn't affect the little finger. So if you got symptoms where you got pins and needles and numbers, and often people wake up, shake their hands at night because they got pins and needles, it's often because that nerve is pressed. So that's carpal tunnel. And then there are various things, exercises and wearing a splint and losing a bit of weight and doing some stretching exercises can help that. So that are preventable as well. But I've lost my train of thought.
What symptoms
pins and needles, waking up at night, pins and needles, numbness. They're what we call soft symptoms, but you should probably get checked if it's persisting. If I bang my elbow, I'm going to get pins and needles. I don't need to see the doctor straight away.
Yeah.
If you have something lasting, a week, 2 weeks, and it's not getting better, then you probably need to see a doctor about why you're getting pins and needles and numbness.
Mm-hmm.
If you're getting altered sensation, so it's feeling numb, again, give it a week or two. If things are getting worse, you need to see a doctor, whether it's of your hands, fingers, or your legs. You probably need to be seen.
Mm-hmm.
And then more seriously is if you start to get what we call red flag symptoms, and you start to get weakness. When I mean weakness is that you find you can't lift your toe up or you can't move your foot. That means something's being pressed against a nerve too hard, and the mechanical side, the muscular side, is being affected.
Okay.
Yeah, and other red flags, particularly for back pain, is things like you suddenly, because your nerves supply your bladder and your bowel,
Mm-hmm.
if they get damaged and pressed too hard by anything pressing on it, like a disc or something, you become incontinent of urine. You won't know you're passing urine.
Mm-hmm.
That's very different from someone who coughs and passes urine.
Yeah.
That's called stress incontinence. That's not what I'm talking about. I'm talking about you be standing or you be sitting and then you just wet yourself,
Mm-hmm.
or you poo yourself.
Mm-hmm.
That, and you can't feel
That
your
you just-
bottom.
yeah.
And there's no sensation of a bottom. That means a nerve's being pressed too hard. That's a medical emergency. You need to seek help that day.
Right.
For those, they're what we call red flag
Red
symptoms.
flag symptoms.
Yeah.
Perfect. I will touch base on that when we come back from break. Unfortunately, the time has passed so quickly. Alhamdulillah. So when we come back from the break, we will talk a bit more about red flag symptoms, and we also like to know if the nerve pain is more in night than day, and is it just a myth? And this and much more, and definitely what are the treatment options? That's the most important part, because that's people like to know. So stay tuned with us. We will be right back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Assalamu alaikum. This is your brother Hassan Rasool. Keep walking with love and light and spreading the harmony around the world.
Behind the headline lie a reality, the shattered hospital, the broken life, the voice of those who survive. On Friday, 26 September, at Dallo Community Center, Luton, hear first-hand testimony from surgeon who just returned from Gaza, witness the truth of what really happening in its war-torn street. Tickets are just £10, including a delicious 3-course meal. All proceeds on the night is for Gaza, providing water, food, medicine. Book your ticket by calling 01582 4818 and act now. Tomorrow may be too late. Jazakumullahu khairan.
For 30 years, we've been opening doors for small businesses and large, opening fully stocked fridges and same-day deliveries, opening birthdays and graduations and new homes and happy tears and new shouldn't-haves, opening ambulances and life-saving support, opening roads that open up cities and countries and continents, opening up the world. See how the Mercedes-Benz Sprinter can open doors for your business at your local Mercedes-Benz dealer today.
Landlords, let us take away the hassle of letting your property. Our comprehensive services include tenant vetting, rent collection and service charges, maintenance and repairs. Ideal Properties has 2 branches and have been established over 20 years and have gained a wealth of knowledge and experience.
If you are thinking of selling or letting your property, then speak to a member of our knowledgeable team about a free, no-obligation market appraisal.
We can also offer guaranteed rental income.
Contact us on either Luton 721110 or 696050. Ideal Properties. Service with a smile, whatever your needs.
Universal Clutches on Cosgrove Way in Luton offer more than just clutch repairs. We also now cover MOTs, servicing, brakes, suspension, and vehicle recoveries. We've got you covered whether you drive a manual or semi-automatic car, van, or truck. We aim to provide a quick and reliable service, and Universal Clutches are an AA and RAC approved garage. For a reliable service you can trust, call 01582 876 300 or find Universal Clutches on Google, Instagram, and Facebook.
Biscott Pharmacy, your one-stop health and beauty pharmacy in Luton, stockist of over 8,000 health and beauty products. At Biscott Pharmacy, we offer a range of services, including health advice and repeat prescriptions for collection and delivery to your home. We also offer a Hajj and Umrah vaccination. Come in and see us and ask about our stop smoking service. We're open 7 days a week till late, including bank holidays. Biscott Pharmacy, 157A Biscott Road, Luton. Call 457709.
Can you imagine losing your parents and seeing your home destroyed? Thousands of children in Gaza have lost one or both of their parents. Agorsh UK invites you to sponsor an orphan in Gaza and provide them with life-changing care, protection and hope. Let's help orphans to rebuild their lives. Donate your zakat and sadaqah for an orphan in Gaza today. £500 per year or £42 per month. Visit Agorsh UK.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome back to Health and Fitness Show. I'm your host Fahad Matin and welcome you back to the second half of our lovely Health and Fitness Show. Today we are talking about the topic nerve pain with our lovely guest, Dr. Talib AbuBakar. Assalamu alaikum, sir.
Wa alaikum salam, Fahad.
So before we went on break, we were talking about the risk factors, and we have talked about these symptoms and impact of the whole thing. So in terms of these symptoms, Dr. Saab, there are a few things which people think that it is true or not true. So I thought I better ask you instead of keeping it in surprise. So is it true that nerve pain get worse during the night time?
For most people, it does. When there is physiological reasons, but the main reason is we're still and we're not doing anything. Our brain's got more to focus on. Yeah. So if there's a lot of noise here, I'm listening to you, but I can. The background noise doesn't affect me because I'm talking to you. But as soon as I've got nothing to focus on, then the background noise becomes loud, and pain's like that. Okay. But the other thing is movement releases your muscles. When your muscles are loose, it's not pinching on the nerve. And that's one of the problems we have, is trying to get people to move. They say, well, what you're talking about, doctor? I'm in pain. Why should I move? And the example I always give them is, if you just hold your hands now tight into a tight fist, and if everyone at home wants to try this, hold it tight and just open it, you'll see your palm has gone white. That means the blood supply is slowed down. My muscles working hard with my hand in a fist now is working hard. Lactic acid is building up, muscles are getting tight, nerves are being squeezed, lactic acid's burning away at the nerves. Guess what's going to happen in 10 minutes? That's going to hurt. In about 30 minutes, if I don't move it,
it's gone numb.
It's going to start to tingle, it's going to get tender, my hand's going to start paining, and I'm going to find it difficult to move because the lactic acid is now really causing pain. But what I need to do is get it moving, to get the blood supply going, to loosen up the muscles, to allow the blood to take away the toxins, the lactic acid particularly, that's causing the pain. So what happens at night? Most of us are still, not moving, muscles are getting tighter, we've had a long day. And if you've ever been on a long run, your muscles will ache after doing something. And what we need to do is move it and loosen it up and stretch before you go to bed. And do the same thing first thing in the morning. And so muscle tightness is another contributory to the pain.
Okay, so in terms of the when we talk about and you just mentioned about the nerve pain, that people who have gone through nerve pain have they have mood swings as well. So does this affect a mental health and B, a sleep pattern?
Well, it does if you're in pain, particularly if it's due to position or mechanical pain. It will affect your sleep. And pain in itself, if you know, that's how they torture people, put people in pain all the time. It's going to get you anxious, it's going to get you stressed, it's going to get you depressed if it goes on long enough. And that's why part of pain management is looking after your mental health. And it's about, you know, when we've got people in pain who we can't control the pain, and we'll come on to some of the treatment modalities. But one of the things we encourage people to do is things like mindfulness or CBT, cognitive behavioral therapies, to be able to think differently about your pain and how by focusing on other things and doing things, it reduces your pain. The example I always give people is if we were boxers, you know, you could punch me and I could punch you. Normally, if you just stood there and I punch you, knock you out, you knock me out. But because we're so focused on what we need to do to win that fight, we don't feel the punches. Does that make sense? Because your brain's focusing on other things, you don't feel the punches, you don't feel the pain of the punch. But then the bell goes at the end of the whole fight, and both of us, ouch, everything hurts, and later on that night it's going to hurt even more. But why wasn't it hurting during the fight? Is because your brain is focusing on other things. When you change your focus and got other things to do, particularly things that make you happy, laughter, or a sense of achievement, that reduces pain. Yeah, and we see it all the time with patients, particularly, you know, patients in any sort of pain, whether it's cancer pain or anything like that. Those who've got an active life, something to look forward to, feel they have some purpose, or just do a little bit of exercise, tend to have less pain or less painkillers than those who just sit and wonder why they're in pain. And the pain's the same.
Yeah.
So no one's saying you don't have pain, but you have to try and work out what you can do, and you also have to pace yourself. So if someone's in pain, I always say, look, if I've injured my leg, as you know, I do a bit of running, not as much as I should be at the moment, but you know, if I was running 5 miles, if I injure my leg that next day, I'm not going to run 5 miles that day. I need to either walk or jog half a mile, and if that doesn't hurt, then I can go a mile, and then next day rest, and then do 2 miles. Well, your pain is exactly the same. You need to learn how to pace yourself. The example I always give is my mum suffers from quite bad back pain. She's got tight spinal stenosis, where the nerve's being pinched in the lower back. Well, if we decide to go around, she wants to cook, as all mothers do, wants to cook for their children.
Love that.
She stands for an hour, goes through the pain, and the next 2 days she's struggling. So what we said, look, you're doing too much, sit down. So after 10-15 minutes, before your muscles go into spasm, sit down, do your stretches, 1 or 2 minutes, then get back up. Then she could do 20 minutes at a time. Now she can do 40 minutes without too much trouble and not suffer the next day by pacing yourself. And we all have to consider that when we've got pain. The pain is telling you something, that there is some damage happening. So don't force yourself through the pain. But sometimes you have to stretch the pain a little bit.
Indeed. So on that note, let me bring our listeners as well. So listeners, if you have any questions or queries regarding our topic tonight, please give us a call on 01582 481822, or you can send your text messages or WhatsApp on 07779 481822. So, Dr. in terms of the treatment option, now that's something which is something you just touch based upon. But one of the common myths people normally have is that if I go to a GP, all I can go and ask them for a tablet which can take my nerve pain away or any pain away, or some kind of a medication which help me reduce the pain. Is that the case or not?
Well, there are very good tablets. We are understanding pain a lot better. Firstly, is to get the diagnosis right. So we talked about the 3 main causes: diabetes, overweight, osteoarthritis. There are other causes, vitamin B12 deficiency. So that's quite common, particularly amongst vegetarians and vegans, because most of vitamin B12 is in meat, but some people can't absorb vitamin B12. There's a condition called pernicious anemia, where there's an intrinsic factor where the antibodies, your own body attacks it, and then you can't absorb vitamin B12. You need injections every 3 months. So that can cause nerve pain because you need vitamin B12 to form the myelin that forms the insulator of your nerves. And that you can't form it, then the nerve gets damaged, you get pain from that, and then eventually numbness and pins and needles and so forth. So vitamin B12 is one of the things we would look for, because if that's low, we can replace that with the injections. Prevention is if you're vegan or vegetarian and you're not having meat products, then you need to look at high vitamin B12 sources, things like soya, beans and things like that, or buy the supplements. The other one that we sometimes, the more difficult one to diagnose, apart from the ones I've mentioned, is fibromyalgia, and that is quite common these days. We don't know what the cause of that is, just generalized pain that lasts for more than 3 months in various areas of the body, and that's a burning pain. And that is not nerve damage, it's for some reason the processing part of your brain over sensitive to whatever stimulates the pain. So it's like a volume. Someone described it as a volume. It's always on high for some reason,
just like I just made.
And we don't know what that is, what the cause is for that. There's various theories about viruses or multivitamins, but what we do know is lack of exercise, lack of movement, stress, other illnesses like B12 deficiency and things can contribute to that. So we see people with all over body pain. And the third one that we need to mention is vitamin D, particularly for our Asians. You need vitamin D, but pain, you can get generalized pain with lack of vitamin D. So we encourage everyone, adults, to try and get between 800 to 1,000 units, which you can buy from counters extremely cheap, and winter's coming, so even more important to take that on a daily basis. So they're the sort of things that you can do. Then we talked about losing weight, and third is stretching and exercising all the time. So once you're doing those things, because if you do those things, that's more important than me giving you tablets. I think I've said on your show before, if you've got a chair that's 5 kilograms and you're 20 kilograms overweight, you're carrying 4 chairs. It doesn't matter what painkillers I give you, your pain, if you're going up and down stairs all day, carrying 4 chairs, is going to be painful. And my painkiller is not going to
help you.
Well, it'll help, but not as much as you think it would. And then I have to give you bigger doses with more side effects. Whereas if you lost the weight, if you put down those 4 chairs, your pain will be far less. You won't need the painkillers. So it's important to do your things as patients, and then the things we would do is depending on the cause. So start off with simple painkillers like paracetamol. If they can take ibuprofen and don't have any stomach issues or kidney issues or heart disease, ibuprofen, naproxen, these are the sort of things we would give as anti-inflammatory painkillers. And then for short term, and this is the important thing, short term things like codeine, and all those groups, codeine, Meptid, tramadol. The next step up is morphine. Okay, but they're short term, because the problem is the senses get sensitized, they get intolerant to it. So what I mean by that is, once you keep taking the painkillers, your body forms a tolerance. Before it becomes addicted, it becomes tolerant. So you need more of the painkillers, and it doesn't work. Then you end up getting addicted, so you can't come off the painkillers. So we in the olden days, we used to just give painkillers and say let the pain drive it. But nowadays it's saying yes for short terms when it flares up, but then most of the time you should try simple things like heat pads, ice cold pads, movement, mindfulness, stretching.
So if I'm not mistaken to understand, these two things will go hand in hand. So you will have painkillers to manage your pain down, and then exercise and mobilize your body with different other remedies.
And try and prevent the severity of the pain.
And then it helps to reduce down
exactly. So when you're, if you bent over and suddenly lifted something and your whole back went into spasm, and then you're on the floor, you're not going to be doing the exercises I show you. There are simple breathing exercises to relax and, imagine my fist. Even just tiny movements is going to get some blood supply through.
Exactly.
So tiny movements of your back, but you're not going to do the back strengthening exercises that you need to do later on.
Mm-hmm.
So, you need a little bit of movement. You've got to be sensible. So you can't suddenly keep going to work or suddenly play football or something with a bad back. You'd be surprised some people do that. So you've got to be sensible about listening to your pain, but then don't be frightened by your pain. So think of it like plasticine. You don't want to suddenly stretch it, but you want to keep stretching it until it becomes much more flexible, which then releases the pressure on the nerves, releases the pressure on the bones. What most people do is just stop and everything gets tight and wonder why the pain's getting worse.
So does paracetamol, you mentioned paracetamol and ibuprofen, does that help as well?
It certainly helps. It's got least side effects. So what I'm going to do is go through what we call the pain ladder. So you start off with the simplest things, paracetamol first. Ibuprofen you can add to it as long as you're not allergic to it or had any problems with it before. Then the next step would be codeine-based things. And you can start off with 8, 10, 15 milligrams, then 30 milligrams, 8, 15, 30. But they tend not to be long term. So that's paracetamol, anti-inflammatories. Then you've got your what we call weak opioids, which is codeine, Meptid, Tramadol. They're very addictive. The side effects of lightheadedness, dizziness, feeling foggy all the time. People who drink say it makes them feel like they're drunk. Brain fog, so you're not thinking clearly with them. Constipation and addiction. So they are problem tablets, but they're good in the short term to help your pain. The next group of tablets for nerve pain are what we call neuropathic pain tablets. So they're things like, so they used to be tablets that we used for other things like antidepressants or epilepsy. What they found with those tablets, with these people were suddenly saying, oh, my pain's a lot better when I took these tablets. So amitriptyline is one of the first ones. A lot of people are on amitriptyline. Start off with 10 milligrams. In the olden days, we used to use 150 to 25 for depression. But what they found with 10 milligrams up to 50 milligrams seems to help pain, nerve pain. And it's really effective for nerve pain. It's also used for things like migraine and other types of headache, but for nerve pain, it's quite good. If that's, once we get people up to 50 milligrams, or the side effects are too much, which is dry mouth, blurred vision, dizziness, we then move on to the next group, which is either pregabalin or gabapentin. And they used to be epilepsy drugs. They're also sometimes used for acute anxiety. But they, again, we start off low, and they seem to help. And if that doesn't work, we move on to something called duloxetine.
Okay.
So that's the three.
The three.
And then after that, you can use, it depends what the cause is, surgery for carpal tunnel. You might need a disc removing and things like that. So, talk to your doctor. But if it's something simple like your B12 is low, then just replacing the B12 will sort all that out.
So how do a person know that their B12 is low?
If family history, if they're vegan and vegetarian, it would be worth getting checked. Or as part, you'll go to your doctor. I've got pins and needles, and one of the tests we would do is a B12 level.
Okay.
Sometimes it's get picked up because you're anemic. You have blood test for something else, and your hemoglobin, which also needs B12, is low. But the cells look big. That would point towards you needing a vitamin B12.
Okay.
And a blood test.
Now, in terms of other things like massage therapies, alternative therapies, does that help? Like you mentioned about CBT, which is cognitive behavior therapy, but then again, there's CBT, which is like the CBD. Sorry.
Yeah, I'm not a fan of that. The less medication, I'm fine, but people swear by it. But we can't prescribe it. That has to be done by specialist pain clinics and things like that. But I know you can buy certain variants over the counter. But what we call non-medical treatment is really good, really effective. So massage, as I said, if your muscles are tight and I massage it, it loosens it up. It's going to relieve pain. Heat gets blood vessels dilated. It relieves the pain. In the acute phase, when you've injured yourself there and then, ice is best because it reduces the damage, that slows down the damage. But heat after a while, and movement, massage, a TENS machine. It's a little electronic thing with two pads, and it just stimulates the nerves on either side of the nerve that's painful, and then that reduces pain. So it's a bit like, if you got elbow pain, I keep hitting your head. You're not noticing your elbow pain much. So this is a short, sharp, and they're quite effective. They're quite cheap, 15 to 20 pounds, put on either side of your pain for 10, 15 minutes at a time. So you just raise it until you feel a bit of relief with it. If you raise it too much, it in itself can be painful. But that's, so you want to avoid the addictive drugs by using some of these things, and rest when you need to, but you need movement as well. Yeah. Because when I've got people with back pain, the first thing they do, they stop walking, particularly the elderly. And what you want to do is build up your core muscles so that you don't get movement. Because imagine if you stand up and then all your muscles are working hard to keep you stable, because they're weak, those muscles will start to hurt.
Exactly. Now, in terms of, unfortunately, in our community, there's so many myths and misconceptions all over the place. And one of the thing is that nerve pains normally happen when you are getting older, or as you're getting older, you will starting to get nerve pain. Is that true?
The conditions we talked about become more apparent as we get older. So in terms of that, yes, but getting old per se, you shouldn't have pain. So I've got people who are in the 80s and 90s who've exercised all their lives, who are very flexible, who keep moving. They don't seem to have pain because their muscles are flexible, their muscles are strong, their core muscles are strong. They say by age 45, 50, you should be doing more core exercises. So that's weights and core. And you don't need to go to the gym. You just need to look up on YouTube core weights training, and it shows you squats and lunges using your own body weight. Because, in your 80s and 90s, you want to be able to get up from your chair. You want to be able to get up from your toilet to walk or go to the toilet. Yeah, that needs a good strong back. It needs good strong legs. And if they're strong, then you get less movement of your joints. And if you get less movement of your joints, you get less irritation of your muscles. The muscles don't go into spasm, which then don't catch the nerves, or the disc doesn't move. So they're quite important to do those exercises as we get older. So yes, it's a myth in a way, but yes, lots of things get worse as you get older.
One of the other myths is that can vitamin deficiency cause nerve pain?
Yes, we've talked about that already. So vitamin B12, vitamin D deficiency, and poor diet, because that stops lots of other nutrients being absorbed.
And tingling feet, it's because of poor circulation and not nerve pain.
You can get altered sensation and things with poor circulation, and again that goes hand in hand with diabetes or smokers, particularly if you've got a family history. So one of the tests we would do is just check your pulses and make sure your pulses are good. If you press your toe, most people's toes are red in the pulp. If you press it and let go and the blood returns within 2 seconds, it's unlikely you've got vascular problems. Or if you can feel your pulses, which is the back of your ankle, on the top of your between the second and first toe, there's a pulse there. If you can feel those, then it's unlikely that you've got any vascular problems.
And most common issues in men is sitting on a toilet seat for 2 hours and then standing up and cannot feel your legs.
Well, firstly, I'd ask why. A lot of it now is because people are scrolling on their Instagrams and social media, so that should stop. Secondly, why are they sitting so long? Is it because they're constipated? That normally relates to bad diet. So they need more fiber, more fluid to make sure they're going to toilet properly. But the reason you get pain is because the sciatic nerve, which is one of the main nerves, runs through the back of your leg. So if you're constantly putting pressure on it, it's going to start to get a bit bruised, and that's when you get your pins and needles and pain.
So is that the reason for triggering sciatic nerve?
Well, the sciatic nerve starts from lower back, so, and it joins together mains. So it can be pressed at lots of different stages. So you can have a disc that presses it. You can have osteoarthritis where the bones are moving and irritates it, or you can have pressure from elsewhere. So there's lots of different layers where it can be affected.
So in terms of Wow, the time has passed really quickly. We just have 2 minutes. So just catch if you like to do a quick round of catch up. Is so people who are listening today, what do they think about nerve pain? What is the first step they should take? And what is the top advice you want to give in one sentence? Because we just have 2 minutes to end the show.
So it's think about what you can do.
Mm-hmm.
If it's persisting 3-4 weeks, you need to see a doctor. Red flags we mentioned, sudden weakness, not being able to move, or numbness completely, that needs to be seen that day.
Mm-hmm.
Most people is about losing weight, healthy exercise, and things like that. X-rays and MRI scans, not particularly helpful. We're going to run out of time about that, but a lot of people ask us. If you look at 40-year-olds, at least 50% will have some form of disc problem.
Mm-hmm.
Then that leaves the doctor's problem. Do we take that disc out? Do we inject? Do we do a major operation on the back? When actually what we are more concerned about is your symptoms.
Mm-hmm.
So if your red flags are showing, or the symptoms are getting worse in terms of numbness, pins and needles are getting worse, and we can tell which nerve is being affected by the symptoms you've got, that's more important than what a scan shows. Often we only do a scan when the red flag starts to show.
Okay. And in terms of the medication go hand in hand with physical activity, correct?
Well, physical activity, weight loss, and all the things we talked about first. And if you need the medication, they are useful.
Perfect. Okay. Thank you so much, Doctor, for coming to our show. And thank you so much for sharing this lovely and vital information, which most people of us, among us, unfortunately suffer with. So thank you so much for coming to our show.
Pleasure.
And thank you so much for sharing those information. And thank you all listeners for joining us today and listening to this lovely show. If you miss any part of the show, you can always listen to the whole show on Facebook or YouTube, which is still there. But until next week, do remember us in your du'as. And until next week, I'm saying Assalamu alaikum.